Hey, Doc Steve here, and in view of the official COVID-19 death count in this country recently surpassing 1 million deaths, I wanted to do 2 or 3 videos on the controversy about the death count. And you'll notice in my title, I said the death count is wrong. And the reason I can use that rather provocative title is that everyone pretty much acknowledges that the death count is not exactly right. I mean, if it was exactly right, that would mean that every single death certificate was filled out exactly right. Every single bit of data was accurate. And I don't think there's anybody in the business that thinks that. However, the real question is the death count a significant overestimate of the actual deaths due to COVID, or a significant underestimate, or just about right? And that's what I want to answer with these next few videos. So this is literally a little like Goldilocks and the Three Bears, because there's one whole group of people online who think that the official death count is a way overestimate of the actual death count that we've had due to COVID. And they're the Papa Bear people. And then there's another whole category of people online who think that our official death count is actually a way underestimate. They are the Mama Bear people. And then, of course, in the middle, we have the CDC and the Johns Hopkins group, where both of the main lists are tabulated, and they think that the death count is just about right. Now, in this analogy, I get to be Goldilocks, because I get to tell you at the end whether the official death count is too high, too low, or just about right. So before I get into this discussion, I want to say something about the number 1 million, because for most of us, 1 million is just that. It's just a number. At the time that I'm recording this, the official death count is now 1,054,000. That number is the equivalent of the American dead from 18 plus Vietnam Wars in a little less than 2.5 years. Just take a minute and let that sink in a little bit. If that's true, that's jaw-dropping. It kind of slaps you in the face. For me, it's hard to process, and especially having lived through the time of the Vietnam War, it just stops you in your tracks. And if that's true, if that's really what the death count is, or as the Mama Bear people say, a lot higher, then you really have to question whether we should have been even more aggressive than we were in this country in terms of controlling it. By the same token, if the Papa Bear folks are right and the actual death count is way less, then it's a real valid question as to whether we really overreacted to COVID. So you can see that this question is kind of the bottom line question for COVID in terms of our response. So in the third video, I'm going to talk about the Mama Bear folks, those folks who think that the official death count is way too low. But in the next 2 videos, I'm going to talk about the Papa Bear folks. And they have 2 main arguments that they bring up to suggest that the death count has been way overestimated. In the second video I'm going to talk about the death certificate information, which is one of their main arguments. But in this video, I want to talk about an argument that's frequently brought up online, and that is this idea that since hospitals get paid extra for COVID patients, they're overreporting deaths as COVID deaths in order to get that increased reimbursement. Now, on the face of this is pretty reasonable, because the idea that hospitals would possibly falsely report patients as COVID patients to get extra money is actually kind of reasonable. And there is a kernel of truth to this, because very early on, Medicare decided that they were going to pay extra to hospitals for COVID patients, about 20% extra. But this morphed very early on to not just that hospitals would report patients falsely to be COVID patients, but that they would report deaths to be falsely COVID deaths. And there's actually another morph of this that came online very early on. Some people were actually starting to say that hospitals would kill you to up their COVID death counts. And when I first heard this, I was like, nobody believes that. But then I had the very unfortunate experience of having a patient come into the ER who, after a little while, eventually admitted that he was a little worried about coming into the ER because he was afraid we would kill him to up our COVID death count. And you gotta know that if I personally meet one person, there's a lot more people out there that believe that. Now, I want to leave aside the argument about hospitals falsely reporting patients as COVID patients to up their reimbursement, because that's actually reasonable. And I want to address this. Not only is it personally very depressing to think that patients actually believe that we would kill them to up our reimbursement rates, it's also ridiculous. Now, I would completely admit that plenty of doctors are not the sharpest pencil in the box. In fact, a lot of them are kind of dumb. I will completely give you that plenty of doctors don't keep up with recent advances in medical treatment like they should. And I'll even give you that plenty of doctors are more into the profession for the money that they make than for taking care of patients. But the idea that doctors would kill patients to increase their reimbursement rates is crazy. Now, absolutely, there's been cases of doctors killing a patient over a possible inheritance, killing a patient over a love triangle. There's even been some doctors who've killed multiple patients over time in a hospital. But guess what? Those people are generally certifiably crazy. There's no doctors that kill patients for increased reimbursement rates. And I would challenge anyone to find a confirmed case of that online, because if you do and send it to me, then I will wear my Goldilocks wig in public for a full 24 hours. So having dispensed with the bizarre morph that was totally depressing to me, I want to return to this issue of hospitals reporting non-COVID deaths as COVID deaths. And this is a reasonable argument. The problem is, the first time I heard this argument, my immediate response was, well, you don't actually get paid extra for a COVID death. You get paid extra for an admitted COVID patient, but not for a death. There's no extra money when the patient dies. So there's not actually an incentive to report a patient as a COVID death. Now, some of you will say, and rightfully so, well, if there's incentive to report a patient that's not COVID as COVID and that patient dies, well, then you've got another death, right? And that is true also. But the problem with this whole line of reasoning is that even though there is an incentive to do this by hospitals and providers, there's an extreme disincentive as well. And let me explain what I mean by that. When you report a non-COVID patient as a COVID patient to get extra money, that's called health insurance fraud, and it is a crime, and there are severe penalties. Okay, for the individual provider, there are severe fines, sometimes per case. You will almost certainly lose your license, and you could go to jail. Now, in my company, I work for an ER doc company, and we have mandatory education every year about avoiding fraud. It's a very big issue, and there's an extreme disincentive for the individual provider. Now, for hospitals, there's even higher fines, and the eventual outcome for hospitals can be the inability to charge for Medicare patients. And if you lose that ability as a hospital, you are done as a hospital. So yeah, there's an incentive to do this, but there's also an extreme disincentive. And not only is there extreme penalties here, but it's actually very easy to get caught in an age of computers, because the agencies that police this basically look at the data. And they look for hospitals that have, for example, a lot higher percentage of COVID patients. And they say, this one has a lot more COVID patients. Oh, they're in inner city New York. Maybe that's okay. But here's one in rural Tennessee with way more COVID patients. We need to take a look at that. So no actual incentive to report a COVID death as a death. And as far as reporting patients as COVID patients when they're not COVID patients, extreme penalties for which is very easy to get caught. But there's actually a third reason, and that is that none of the folks making up these lists at the CDC and Johns Hopkins use reimbursement data. They don't look at what hospitals send into Medicare for reimbursement. They look at state and county health department reports and death certificate data. That's basically what they look at. They don't look at what the hospital says the diagnosis was in order to get reimbursed. So I'm not saying it doesn't ever happen, but the idea that this is going to happen at the level which would significantly change the death count without us hearing about it and hospitals getting caught is kind of ridiculous. And like I said before, that data is not even getting included in the list. So very unlikely to change the list significantly. So the next video is going to be about Papa Bear's arguments with respect to the death certificate data. And that's a very interesting topic. So stay tuned for that. But if you like the video, look at my other videos on COVID on YouTube at Doc Steve. And also you can look at me up on Instagram, DocSteve16. But until next time, thanks for watching. See ya. Bye.